Assalamualaikum. So today is a podcast. It's been a while I haven't spoken to you guys and about this, what it's like to be a cancer patient. I thought I'd tell you the reality about it. So the title is What It's Like to Be a Cancer Patient, and I think what's the best way to talk about it is someone who's dealing with self. Whenever I scroll in the Instagram, it usually comes about cancer. And I saw a post about Zosa Bain. I think you guys know she was living in America and she was talking about her cancer journey. And in For You page, you see people talking about it, and I can relate to her. And she was a very happy, content person. She was only 14 years old and she has passed away recently from cancer. When I saw the news about Zosa Bain's passing away, obviously I was shocked. I was like, oh no. I really thought she could do it, fight for it, because her cancer relapsed after 5 years. And I really thought, but you never know because you see pre recorded videos and you never know when, how, where. I understand that many of people are annoyed with the vloggers, with content creators that doesn't post any dates. Sometimes they don't want to. We're trying to guard ourselves because we don't want random people following us or anything. And I totally get it because I think I'm doing the same thing. It's always nice to see someone, especially even YouTube or Instagram or TikTok, you can connect with other cancer patients. You don't want to feel alone, and that's how it is. For us, especially who's dealing with cancer, scans, blood tests, these are normal for us. I'm trying my best to be strong, guys, for you guys. I'm trying to be strong. But sometimes I don't feel like being strong at all. Like, I feel like the pressure on, like, people think, oh, we're influencer, we're a celebrity, we have to be strong, we have to have thick skin to able to have criticism about us. No, we don't have to. Rumors are not always true. Rumors are false news all the time. Well, in my case, people just spread news of rumors about me was actually false, to be honest. Sharing my cancer journey in the first place has been very difficult for me, especially. I still have flashbacks. When I talk about cancer, I just literally, I'm gonna be honest, I have distracted myself so much from from cancer. I just try to, how I get on normal with my life, I just distract myself. I don't think about it. There's another cancer patient talking about another cancer and you can relate to them. Or when I go out, I see cancer research on there, like, or someone talking about cancer. As much I want to forget about it, it just comes on the face. You know what I'm so scared of? Cancer coming back, because they told me your cancer can come back again. And we're waiting because they're saying maybe 5 years time it might come back again. We don't want that to happen. Having lots of anxiety, depression around this. I'm grieving every single day. I'm so scared every single day because I don't know what's cancer doing in my body. I'm trying not to cry and not doing it for sympathy either, because people think crying is weakness, but it's strength, honestly. Crying does not mean weakness at all. I'm just thankful to God that Allah has given me the tears that I can cry, be emotional. It is true that it's taking a long time for me to edit vlogs. I have chronic pains. Bone pains is chronic at the moment and it's invisible. I'm gonna be honest, I have pain here on the wrist. So for me to even use this phone is really heavy. So I hold it, I get really hand pain, and even holding this gets hand pain. I'm literally in pain and my back is aching. It's invisible because I'm trying to be strong here every single day. I'm trying to be strong here. I'm trying to be making sure that no, I'm not gonna let this cancer defeat me. I'm not gonna let this happen. But honestly, the reality is that I've given up on this because I'm tired. I'm tired of fighting every single day. And a lot of people say, no, don't give up, don't give up. The muscle spasm is part of my osteoporosis. The teeth bone loss situation is osteoporosis. I'm losing my teeth because of the osteoporosis. It all makes sense now, right? Cavity situation, it's because of the chemotherapy, very intense chemotherapy. I am just happy that I was not able to film during that time. I wasn't on social media because I know how toxic it'd be. I said to everyone, I need a 1 week break from social media. It started with anemia in 2020. I had weight loss situation, hair loss situation. Even I thought I was allergic to castor oil and my eyelashes literally was gone all the time. And I was like, what's going on here? There's something going on. And I get tired and I felt breathless and I fainted. Like my family has seen this all because I used to live with them. When I had my chemo done in 2021 in May, basically, we're talking about the first cycle. After that first cycle, I didn't complete it because I was reacting with rituximab. They were treating me as a high grade patient. So the chemotherapy that I got was very intense, very strong medicine. And for me to get that, I thought I could do it. I can go alone and I could do it. But honestly, I was landed in that wheelchair. I landed in the wheelchair in the first cycle. I was the last person to get free at 9 p.m. So I had to come 9 a.m. to 9 p.m., 12 hours. And then I was on the wheelchair waiting for the taxi. And even I said to the taxi driver, I can't walk. And he somehow helped. And my bones were aching. I was in pain. All I could feel, I was tired from this chemotherapy drug. And no, I did not complete my first cycle because I had a reaction with rituximab, and rituximab does give reaction. Depending on each body is different. Everyone's different. You get reactions, and I got it. I couldn't complete it. I literally told them to stop it, because my body gave up on it. My body was not strong enough. Every single time I had anxiety, I was like, trying to breathe. I was alone. They didn't. My sister wasn't there with me because they didn't let anyone during that time. I was in lockdown time, guys. I was all alone. I didn't have anyone with me. I was just literally crying because I didn't know what to say, and I was just like, it's too much for me. And I was kept telling people, please pray for me when it goes really successful. But the first cycle was not completed. I had to complete it in 2 sets, in 2 dates, basically. So one was in May and one was in June, and I completed my first cycle. But beforehand, so before even finishing the cycle 1, I wanted to give up. I wanted to give up because the chemotherapy that I have, which was R-CHOP chemotherapy, you can have a look at yourself. It was so intense that it killed my body. It killed me. My body was feeling like, that's it. I want to give up. I want to give up. And literally, I was saying to my sister, like, I don't want to do this. Literally crying. I was telling them, the nurse specialist, I was literally having a conversation with them. I said, I can't do this. I was supposed to have it before in May, basically, the first cycle. But I said to them, no, I can't do this. I can't do this. I can't do this. I had a deep conversation with them. They said, we can't give you any other medication. We need to give it to you so that you can be remission. Having this hope of you'll be remission. When you have this finish after 6 months, you will be in remission. That's what they kept telling me. I have no other choice to accept it. To accept that I'm taking it. I'm glad that I took 1 week break from social media because it could be very toxic and I couldn't continue. It's traumatizing. I don't want to talk about it. It's so traumatizing. That's why I'm so scared to go back again for the chemo. I just, no. I don't want to cry. I don't want to cry. I don't want to have a sympathy, guys. I just want to share my cancer journey. Cancer is invisible. Cancer is quite common. Bowel cancer is quite common. Bowel cancer, brain tumor is so common. Breast cancer is so common. Now blood cancer is also common. There's so many people are dealing with blood cancer. Sometimes I feel like we're being overlooked. We're not being able to look. But there are charities that are looking into the disease, trying to find cure. There will be. We just have to keep on hoping and praying. Honestly, my hands are aching. I have bone pains. I am having pain right now. I think the best thing is to hear if your cancer is stable, not to hear something like relapse, I hear about things. I get really nervous for hospital appointments, not gonna lie. I try to look strong to you guys, but I'm actually inside, I'm literally dying. I can't deal with it. I get anxiety easily and I get dry mouth, and I obviously have to keep on drinking water. It is really, really hard, to be honest, to be a cancer patient because people expect a lot of things. They think like we're a normal person, we can put videos up in time. No, you can't. Not especially with chemo. Hats off to someone who can do editing during the chemo and put it up basically, because I seriously did not take. I didn't make videos. I didn't make like videos. I only like took photos and video of, small short clips. Really cannot stand cold. That is something new symptom that I got from the chemotherapy, or the side effects from chemotherapy. That's what they said. The chemotherapy, guys, kills the healthy cells. It kills you. And I'm telling you this because it doesn't improve your quality of life. It literally, I not in, yeah, you guys know the opposite. I'm trying to say it doesn't improve your quality of life. It actually lowers it. Okay, I'm not gonna talk too much about this. Okay, so I don't know. I'm just gonna go for it. I'm gonna talk about things that really hit me. You know what's hitting me so much is I'm not in denial. Okay. This topic's very touchy because nobody talks about even so many people ask me, how much life do you have? So many people ask me that, which is hard to answer because I don't know. God knows how much life I have actually. My sister said we doctors are not God, so we don't have that answerable. But I I, I don't want to suffer this in silence anymore. So it was a male consultant. Um, he said, with this cancer, you don't have normal life, obviously. I'm just a girl trying to live my normal life with this cancer, right? That's what I'm showing on vlogs for you guys, trying to make positive content, but it can't always be positive content. He said, like, how much life I have, right? And I think this has hit me somewhere, and it has always hit me because it's 2021 until now I'm listening to it. Because a lot of people, it is really hard to be a cancer patient. It's overwhelming. It's tiring. It's tiring every single day. It's very tiring. Every single day, I distract myself so I don't cry. I'm trying to make myself happy. Art makes me really happy. Henna also makes me happy. So anything art particularly I like. You guys have seen it on my shorts and also here videos that I've shown you doing art basically. And when I have my chemotherapy, that you will lose hair. So it depends on each drug. If you I have not been told you can get chemo cab or all that. They told me not to even read it, because I'm very anxious. So they were not telling me, they were telling my sister. It was like this. My consultant was writing an email to my sister, and my sister writing to me. And of course, she was working at the hospital, so she can't always email what the. It was more like I never got the email directly from the consultant. Don't find that professional. You'll be remission after this chemotherapy, but reality is that you won't be, basically. And they told me you won't be, basically. I mean, I wish I was told this beforehand, but I think they want you to finish the chemotherapy cycles. And they said it can take 5 months or 6 months, depending how you are. After the chemotherapy cycles, I'm glad my mom came with me and she was there, but you do feel your bones are aching. You feel the whole hip bones, everything is aching because you're also on steroids that helps the inflammation, everything. Alhamdulillah. But I remember like I wanted to listen recitation of Surah Iman. I couldn't speak, guys. I couldn't speak. It was that bad. I couldn't even open my mouth and say because I was feeling unwell and sickness was not helping at all. One thing more, I've noticed that I do tend to forget things. So what I did yesterday or 2 days ago or 3 days ago, I literally forget it. So I have to write down things. This is a chemo brain fog. Especially if you're on a HRT, you would understand that you're gonna have brain fog. That was the part of it where I was missing out. Some days I couldn't understand what was the date. I had these episodes where I literally forgot the date. I thought, oh, this date went, or I forgot even my address. It was one of those things. And they say that could be because of the HRT, you're not on it. It's been 3 months, I'm not on HRT, and I'm freaking out with that. I also need to speak about this because, like, I am tired going back and forth gynecology appointment and then go back to GB appointment and then go back again. That's what's been happening, and I they say I cannot be without HRT, and the strength is 50. A lot of people ask me that question, if it's 100 or 50 or 25. I can't stand even 50 basically, but let's just hope what the gynecologist says. We have to accept things. I think this is the problem with us, is that it takes so much time to process things. We're not in denial. I have to mention this because I was not in denial when I was told how much life I have with this cancer. I'm trying hard to be strong to you guys, but I'm not. I sometimes feel failure. I feel like I'm failing from this situation. A lot of people tells me to not give up. That motivation I need from people. Thank you. You inspire me. Thank you. You're stronger than you think. Thank you. Allah's with you. Alhamdulillah. So, yes, these motivation, but I'm also human. I'm not perfect. I'm not a perfect Muslim. I have make mistakes. We're all sinners unless we repent to Allah. Every single day, if we do istighfar, it makes me really happy. So when I worship Allah, when I worship God, I feel more calmer, more peaceful in my life. That's how I deal with it every single day. But I can't always be strong. I have those days where I just want to cry and cry and cry. Because that's how I deal with it. How I feel strength, you know. But some people think this is weakness. This is not weakness. Just because you cry does not mean you're weak. You're crying just because you feel sorry for yourself that you're in this situation. But then you're thinking, maybe that's how Allah wanted. Thank you so much for family, relatives, for people who I don't even know. Thank you so much for silently praying for me, even not commenting. I don't know who my views are, so thank you so much for silently praying for me. I'll be immune compromised. So that's also a problem, guys. This is what I need to say. Even we are cancer stable does not mean we're free from cancer. Even if our treatments are even our treatments have stopped, it does not mean we're cancer free. We're still living with cancer. They did ultrasound this year, and I found out that spleen is 13 centimeter. They found that there's an abnormal protein in my body, but it's not active. As long as it's not active, that's fine, right? It's stable. And that's why they say chronic, because it has been always like this, stable, stable, stable. It's normal for cancer patients. Scans, blood tests, or bone marrow biopsy. I don't want to go through so much pain in my life right now because I just wish I'd never had issue with my teeth. I never had cancer. I wish I had never had cancer, honestly. I would not even have osteoporosis in the first place. I wouldn't have a menopause situation. By the way, having menopause, you have so much problems. God has chosen me to have this cancer go through, and I'm here talking to you guys, sharing with you guys, trying to be strong, but I cannot be strong all the time. I'm tearful. I'm just not been, and honestly, I've not been myself with this medication. I'm just tired of fighting, fighting, fighting. I'm trying my best, guys. I'm trying my best, and whenever I see, whenever I see someone passing away from cancer, it feels bad. I really thought Sosa Bain will be there with us, and I really hope and pray Tiffany things gets there. I've seen her videos. I can relate to her. You know, when you watch someone, you really want to know where they are at. I really wish she can be cancer free. I hope and pray she can. But it takes time to process things. It takes time and effort to process these things and accept them. It takes time. It took me months to accept my cancer journey. How do you expect the other person? Everyone's different. Everyone's body's different. Just don't listen to rumors all the time, especially those people who doesn't like you. Yes, there are reason for you doesn't like you, but doesn't mean that these rumors are true. Speak to me on Instagram. We will talk about it. If you don't like, what is it that you don't like? Look, the lifestyle that I talk about here, sharing my journey, of course it's not going to be the same as you guys. Of course there are some points you won't agree of. Just be respectful. There's you don't no you don't need to be so bashing other people for having opinion. I'm sorry, I'm just the more positive, the more it will bring you lightness, the more negative it will bring you darkness. I hope, inshallah, I will see you in the next video. Hopefully I will able to upload my autumn vlog, hopefully inshallah next week. You guys take care of yourself, and thank you so much for listening, for being there for me, and subscribing to my channel. If you can subscribe to my channel, that means a lot for me. If I'm trying to reach 2K subscribers, so if you can help me, that would be great. And there will be a giveaway 10K subscribers. So thank you so much for listening to me, and take care of yourself. Assalamualaikum. Bye.